Scott Gottlieb, Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. In a world left reeling by the ravages of COVID-19, Uncontrolled Spread, by Scott Gottlieb dives deep into the pandemic's origins and reveals the weaknesses in global response systems. As readers delve into this gripping book, they will learn about the early warning signs ignored by the World Health Organization and various governments, particularly the United States. Exploring the consequences of inadequate testing and unprepared leadership, the book gives a candid account of the stark contrast between South Korea's successful response and the abysmal handling of the crisis in the U.S. Readers can expect to absorb vital lessons on readiness, public health, and the pressing need for a strong governmental response to future pandemics.
The Early Warning Signs of COVID-19. Scott Gottlieb, a former commissioner of the FDA, exchanged messages with Joe Grogan of the White House's Domestic Policy Council about a new viral pneumonia outbreak in China in January 2020. Gottlieb expressed his worry about the outbreak and noticed red flags, such as unreliable information from China and the World Health Organization, WHO, regarding the number of infected patients and person-to-person transmission. The CDC was already picking up evidence that the virus was spreading among family members and infecting others who had not gone near the food market in Wuhan. Information on the outbreak was hard to come by, and the Chinese government had a history of trying to hide outbreaks. Despite evidence suggesting otherwise, the Chinese and the WHO continued to downplay the threat. The cost of delay. This summary outlines how delayed action, insufficient testing, and withheld information have contributed to the U.S.'s inability to control the COVID-19 outbreak. Despite concerns raised by concerned doctors through social media, Chinese authorities resisted international warnings, delaying action that would have triggered global health protocols. By March 2020, when the WHO finally declared the outbreak a pandemic, the virus had already spread beyond China, leaving the U.S. unprepared, with only the CDC as the sole agency with the ability to test for the virus. The CDC's refusal to share copies of the virus led to a bottleneck of submissions far exceeding its processing capabilities. The delay in effective action and testing cost precious time, leading to widespread transmission and significant loss of life. U.S. Pandemic Preparedness. The U.S. was ill-prepared for COVID-19 due to its focus on flu-like outbreaks and bioterrorism. Lack of understanding and testing compounded the problem. The U.S. government's pandemic preparedness strategy had been centered around dealing with flu-like outbreaks and bioterrorism. However, when COVID-19 emerged, it became apparent that the virus didn't behave like either of those things. The lack of information about SARS-CoV-2 in the early days of the outbreak made it difficult to understand and detect. The CDC's initial guidelines emphasized cleaning surfaces and washing hands, which proved to be ineffective as the virus was mainly contracted through respiratory passages. The U.S. relied heavily on the Influenza-like Illness Network (ILI), a system designed to detect flu outbreaks, to spot COVID outbreaks. But with many people remaining asymptomatic while spreading the virus, more testing was needed. However, the U.S. was ill-equipped to test people and share information nationwide, rendering it unable to contain the pandemic. In conclusion, the U.S.'s focus on flu-like outbreaks and bioterrorism, lack of understanding, and testing compounded the problem, and the country was ill-prepared to handle the COVID-19 crisis. CDC's inability to manage COVID crisis. The CDC was not equipped to handle the COVID crisis, mainly due to its focus on collecting and analyzing data retrospectively. Although Congress had allotted funds to create a public health awareness network in 2006, the CDC never used it, leaving them unready for the pandemic. The agency's approach to testing was flawed as they were unfamiliar with rapid test development and manufacturing. Had the CDC licensed out testing capabilities to clinics around the country, they could have controlled the spread better. However, as they were dealing with the burden of processing tests and creating mass-produced testing kits, the pandemic worsened. The government and COVID-19 testing. The government's handling of COVID-19 testing was fraught with challenges, from delays to contamination and mixed messages. The Centers for Disease Control and Prevention, CDC, struggled to keep up with demands, relying on both PCR and antigen tests. While PCR tests are more accurate, they require lab analysis and can lead to delays. Antigen tests, on the other hand, produce quicker results but are less accurate. The government spent millions on antigen tests, but with no coordinated plan, many were sent to the wrong facilities. The lack of consistency in non-pharmaceutical interventions like masking and social distancing added to the crisis, with individual states and governors making their own lockdown rules. The government failed to provide a coordinated response, relying instead on the private sector for help in the form of the FDA-approved antigen tests. South Korea's Model Pandemic Preparedness. The book highlights South Korea's successful response to the COVID-19 pandemic. Unlike the US, South Korea had the necessary testing, stockpiles, and surveillance to manage a pandemic. After experiencing a severe MERS outbreak in 2015, South Korea established numerous testing sites, stockpiled equipment, and set up a fast-track process for approval and distribution of testing kits. As a result, South Korea was able to ramp up its testing capabilities within weeks, surpassing the US's testing capabilities within 4 months. In addition, South Korea had a nationwide testing and tracking database that relied on some privacy-infringing surveillance. The book suggests that if the US had employed a workforce of epidemiological investigators, things could have turned out differently. Public health, a matter of national security. The COVID-19 pandemic has revealed that public health is a matter of national security. Vaccines produced by Moderna and Pfizer using mRNA technology have shown potential in creating a vaccine that can target specific viruses and can be altered quickly and efficiently. However, the vaccine development and distribution process has become highly political and a matter of national security. Russia and China have been caught spying and attempting to steal information about the vaccine. The US needs to treat public health like other forms of intelligence and have a federal program that can manage and prevent outbreaks. China's refusal to share samples of the virus left many countries vulnerable to the virus. The US needs to begin treating coronaviruses as seriously as other perceived threats.
Uncontrolled Spread by Scott Gottlieb brings the spotlight on the shortcomings of the global response to the COVID-19 pandemic and highlights the pressing need for preparedness against future contagions. The book serves as a wake-up call for governments worldwide to recognize that public health is a matter of national security. South Korea's example and the timely development of vaccines demonstrate the power of coordinated planning and execution. Ultimately, the key takeaways from this profound book stress the importance of accurate information sharing and a well-organized and strategic response to ensure the safety and well-being of the global community in the face of future pandemics.